Yeah, so this is research with Sarah Baradell, who's a physiotherapy educator at Swinburne University, who's not able to be here today. So, slides moving on somehow. And we have published this work as a paper. If anyone's interested, that's a quick link there to get to our paper, as all the details will be there because not a whole lot can be covered in 6 minutes. So just first, a definition of what students as partners means in this context, which is a relational process where students and staff work together to enhance higher education. Respect, reciprocity and shared responsibility are key values associated with the process. So it is a practice that's gaining recognition and momentum across higher education. The literature reports a range of benefits. So for example, students can develop graduate attributes, they can feel more agency around education. There's a little bit of work that shows some improved pass rates as well. The academics who work with students as partners in this way also report benefits such as feeling more inspired about their teaching, having transformed views about their teaching. There are some challenges as well, so you can't really address the kind of power imbalances of that relationship between students and staff. And sometimes academics just aren't interested in working in this way, and there's also time constraints as well. We also found that there was little focus on discipline-specific aspects of students as partners. So what we wanted to look at was how and to what end is students as partners represented in health professional education. So what we did was a through-line analysis, a qualitative research synthesis. I won't go through our whole search strategy, but we ended up with 55 papers in the end. So qualitative research synthesis is a way to interpret data from qualitative studies by looking at the whole sample in a holistic way and looking for new meaning in that set of work rather than summarising that work. So we went through 3 stages of independent reading, also independent analysis, and then finally we did a joint analysis and synthesis to come up with our 3rd order interpretations. Just thought you'd be interested to see the spread of disciplines in this work. So medicine had the most papers on students as partners, followed by nursing, and then a handful of other health professions. So these were our findings, and I'll just go through them briefly. So the framing or the ethos of partnership, what we found was a very pragmatic, practical approach in these papers. So we didn't find many papers that showed an awareness of the wider students as partner literature or theory. So it's quite outcomes focused, and it wasn't really focused on the process of partnership or evaluating the partnership itself. Similarly, the drivers for the partnership were usually in response to a practice-based problem. It was often around students developing their competencies for practice, to learn how to educate others, how to work with others, also exposure to non-clinical career paths. It was also sometimes a strategy of how can we better serve the patients in the community, which led to things like student-led clinics. In terms of sustainability, only a few papers described the development of the partnership over time and how that might evolve in the future. Inclusion of student voice, we found that was in 2 main ways in the paper. So one way was through data from students, so quotes from students, for example, and the other way was co-authoring of the papers. We often found that the inclusion of students wasn't really explicit in the papers. It often wasn't covered at all. So we in the paper, we talk about the dangers of pseudo-partnership. So although our search initially found 3,000 papers that mentioned partnership with students, through our screening, there were only 55 that were really focused on this. And then finally, the understanding of partnership. We looked at the benefits and challenges and the roles for the students and staff involved. The roles were not always clear. It was, as I said before, it was difficult sometimes to get a sense of what the students were actually doing. There were quite a lot of benefits to these types of projects, but also challenges such as logistics and lack of institutional support. So we do have a couple of Padlet questions for you that we'd love to hear any comments or any other feedback you may have. And finally, just some of the key references that we use in the paper. Thank you.